Pop quiz. A charge nurse is making client care assignments for the day. Which task should the nurse delegate to an experienced, unlicensed assistive personnel? A. Assessing the client's level of pain after receiving pain medication. B. Educating a client newly diagnosed with diabetes on insulin administration. C. Assisting a client with chronic obstructive pulmonary disease to ambulate to the bathroom. Or D. Administering oral medications to a stable client. And guys, the correct answer is C, assisting that patient with COPD to ambulate to the restroom. So whenever you're being asked about delegation, if it's a UAP, an unlicensed assistive personnel, it's a CNA, they are not, it's not skilled nursing. They cannot do anything that requires critical thinking. Am I saying they don't know how to think critically? No. I'm saying this to you so you can get the answer right when you're taking your test. If it requires critical thinking, you're not going to delegate to them. So that's why, like the UAPs, they can ambulate patients, they can feed patients, they can pick up equipment, they can do INOs, they can record and report. That's why they can take respirations, they can take blood pressure, they can take pulse, but can they listen to lung sounds? No, because when you listen to lung sounds, you got to know the difference between clear versus wheezing versus rhonchi versus crackles, right? So that's how you have to think. Now, it's a little bit trickier when you're thinking about LPN versus RN. When it comes to LPN, the LPN is going to get the most stable patient. They're going to get the patient that has the chronic condition. There's nothing new going on. There's no new diagnosis. There's no new med. There's no new procedure. Anything that's new, anything that's comprehensive, anything that's complex, the RN has to keep, right? So the RN has to keep the patient that has central lines. The RN has to keep the patient that has to have a piggyback or an IV push or blood or PCA or admission, even discharge. And I know what you're thinking. Well, Professor D, the patient's getting discharged. They're stable. Yeah, they're stable enough for discharge. But guess what else comes with discharge? In-depth teaching, care coordination, making sure that home health is on board, physical therapy is on board, speech therapy, occupation, all that good stuff, right? So when it comes to levels of complexity, the RN is going to have the most complex patient. The LPN is going to have the most stable patient. And the UAP is going to get the patient that doesn't require the critical thinking, if that makes sense.